We know that our doctors check cholesterol levels and screen our blood for signs of diabetes. But what about our pets? Veterinarian Dr. Jennifer Crow from Noah's Animal Hospital joins us today to talk about getting blood work done for our furry friend. Good morning. So tell us about this. You know, I know we get blood tests on ourselves normally annually, but what about for our pets? Should we do that every time we go to the vet?
It would certainly be nice to have it every year just to follow the trend for your specific pet. But when they're young, we're going to do it, and old to screen how the organs are doing. When they're sick, to see if there's any changes inside that are contributing, and even to start screening them for hormone diseases.
So you've kind of run the gamut with different blood tests, kind of what they do for humans, where you may do a basic run, or maybe you're doing something more in depth. What do you decide? How do you decide that?
So a lot of it is, what are we looking for? So some of the basics are going to look at how the organs are functioning. Is there inflammation or change in function with the liver or kidneys? We can look for hormone diseases, changes on the blood tests that are going to suggest diabetes, Cushing's, even thyroid disease, all things that we can manage or treat. And then there are red blood cells, white blood cells. Those change with things like anemia, infection, inflammation in the body. And there's some specific disease processes that will change some of those things, but not others.
What about cancer? Can it screen for cancer?
No, there's not a specific cell in certain organs that are going to say, hey, I'm having trouble. So a lot of it has to do with the big picture.
Right.
With we suspect that there's cancer, is it changing organs? Are they involved? And sometimes we have to do more than a blood test, an x-ray or an ultrasound. But again, having that big picture of how is the whole pet doing is really important in the diagnosis of some of these diseases and cancers.
It makes sense, and you're just trying to pinpoint what issues might come up and how to manage that to help prevent them from getting more sick, just like we do when we get our normal blood tests and you look for those cholesterol levels and things like that. But how often? I mean, typically I take my cats to the vet once a year.
So our pets have a much shorter lifespan than we do, so they age a lot faster.
Sure.
And so there are some times where we want to screen before an anesthetic event. Let's make sure there's nothing else we have to do before we're going to put this pet under for surgery to be spayed and neutered, for a dental procedure. Once they hit 2, just to get a normal baseline for that pet so that we can compare it. When they are younger, middle-aged adults, we may want to do it every 2 years. As they get older, they age a lot faster.
Wow.
So every year, and we can see the changes again for that pet. Even if it's normal, how has it changed for your Fluffy?
So the age just declines a lot faster as they get into that senior part of
age
their
real
life.
fast at the beginning and then at the end. And again, if we've got that information from the start to the end, we can track changes so that we catch things earlier.
Good idea. Getting those blood tests for your furry friends. Thank you once again to Dr. Jennifer Crow from Noah's Animal Hospital for being with us today.